The bacteria on this nutrient agar plate have not been able to grow anywhere near the white discs. These contain antibiotics, the discovery of which was one of the greatest triumphs of 20th century medicine. During the Second World War, these drugs were more valuable than gold, but afterwards they soon became available to the public. On this plate, the fungus in the centre is producing a large quantity of antibiotic, which has inhibited the growth of the sensitive bacteria spread as a lawn over the whole plate. This was the basis of Alexander Fleming's observation. Bacterial susceptibility to antibiotics can also be tested using a controlled sensitivity test. The susceptibility of the test culture is compared with a control culture of bacteria known to be sensitive to the antibiotic to be tested. Both cultures are diluted to approximately 10 to the 5 colony-forming units per mil. This concentration of cells will give a semi-confluent growth. If there are too many cells inoculated, there is a risk that some of the sensitive bacteria will appear resistant because of the size of the inoculum. This is the so-called inoculum effect. If there are too few bacteria, the zones of inhibition will not be seen clearly. The test plate is divided into 3 sections. Control strain is inoculated in the centre section. The cotton bud fell onto the autoclave tinfoil lid of the container, not onto the bench, so it is still sterile and in this case can be used to inoculate the sample. If the swab touches the bench, do not use it. It will no longer be sterile. The test strain is inoculated on both of the outer sections of the plate. After inoculating the plate with both the test and control strains, the next step is to apply the antibiotic discs to the culture. Four discs, each containing a different antibiotic, are carefully placed at the interface between the test and the control inocular. The plates are then incubated overnight. Following incubation, the growth of the test and control bacteria can be observed. If the test has worked successfully, the control strain will fail to grow in the area close to each disc. This is because active antibiotic has diffused out from each disc and has either killed the control bacterium or has inhibited its growth. If the test strain is resistant to the antibiotic, it will grow happily in its presence, and no zone of clearing in the bacterial lawn will be seen near the disc. It is important to spread the inocular evenly over the surface of the different sections of the plate. It is also important to inoculate the control organism before inoculating the test strain. This prevents accidental contamination of the sensitive control strain by resistant bacteria in the test strain. Take care not to inoculate the test strain over the control. Here, the resistant test strain in the upper section of the plate has been inoculated over the control strain, and inhibition of the control strain has been obscured. This makes interpretation of the test difficult. The importance of this test for antimicrobial sensitivity is that it is a controlled sensitivity test. you can be assured that if the test bacterium grows up to an antibiotic disc, that strain is resistant to that antimicrobial agent. This is because antibiotic from the disc will have inhibited the control strain. If the control strain also grows up to the disc, this shows that the disc didn't contain active antibiotic for some reason. In such cases, the susceptibility test needs to be repeated for the antibiotic that didn't work properly. With particular antibiotics, careful examination of the zone of inhibition will show a few isolated colonies growing where most of the bacteria have been inhibited. These are spontaneous mutants that have become resistant to the antibiotic being tested. In laboratories where large numbers of sensitivity tests are performed, a rotary plater may be used. The uninoculated plate is placed on a turntable and is rotated. The control strain is inoculated in the centre of the plate. The swab is dragged from the centre of the plate to the silver ring, visible on the turntable. The test strain is then inoculated on the remainder of the plate, moving the swab from the outer edge of the plate towards the silver ring. Having inoculated the plate with the rotary plater, antibiotic discs must be placed at the interface between the test and control inocular. This can be facilitated using an automatic disc dispenser. These hold up to 8 cassettes, each containing up to 50 discs impregnated with antibiotics. This means that different antibiotic combinations can be used to test the susceptibility of a range of bacteria. The dispenser automatically dispenses discs onto the inoculated plate when the plunger is depressed. The ring of discs coincides with the silver ring on the rotary plater's turntable. The test on the left shows a strain that is fully sensitive to all of the antibiotics being tested. The plate on the right highlights a possible problem. If antibiotic discs have not been stored properly, they will lose their potency. The control bacterium has only been inhibited by 2 of the antibiotics tested on this plate. Consequently, the susceptibility of the test strain to these antibiotics must be retested.